the NHS, really, we've all used it. We all know it. Even those who have private medical insurance, the 6 or 7%, they've all used the NHS. At one time or another, they've had to go to their A&E, they've had to go to an NHS GP to get their vaccine of late. And of course, it dawned upon me that in the latest vaccination round with COVID, it was only the NHS and the government that you could, in fact, get it from. The private sector could not deal with it. And yet, we all use it. We all know the value of it. Every government cherishes it, or we're told they cherish it. They all promise us everything. They all tell us waiting lists will come down, GPs will look after us. They all repeat that it is free healthcare to the whole population. But of course, we do understand we pay for it in our social security, or some of us understand that. And there's almost a schizophrenic attitude and ambivalence to this discussion, that on one hand, we're in love with it, we need it, we've used it. On the other, we complain about it. And what is the essence of it? It's a complete conundrum. One, it employs 1.2 million people. It's the largest employer in Europe. Two, we're told over and over it's underfunded. Three, we have thousands, hundreds of thousands of people say they've got good care. Hundreds of thousands of people say they waited hours and hours and hours. Tens of thousands of people are on the waiting lists. And so it goes on. And we have this diversity of opinion about what it is. Now, I, even having worked in it for over 30 to 40 years, didn't understand the NHS. This is what I understood. One, there will always be reforming it. There will never be a time when it's constant. They will go from Department of Health to Public Health England to regional health authorities to trusts. There will always be a change. In that change, there'll be managers coming in, managers going out, little boys and girls leaving school and telling senior doctors and dedicated nurses that they weren't doing work. There will always be change, confusion, and they will never build on what's good in the past. They will always confuse and be thinking they are radical. In actual fact, they confuse, they change, and then they go in a full circle back to where they were, but with a different name, wasting money in the process of the change. Every change management process which goes from government, maybe in successive governments they change, wastes the resources of the NHS. I believe it's a kind of roundabout of change and a roundabout of waste of money. So they move small units. I'll give examples. There's small units of hospitals. They close them. They have campaigns and it's closed. They then open large health centres which are exactly the same. They decide that they are going to amalgamate hospitals. They spend a fortune on the planning of amalgamation. They then have a demonstration in a particular political seat, as has happened as an example in Essex, and they scrap it all. It's fine. Nobody takes responsibility. They then, in the NHS, have a confusion of roles. They have an emphasis that they're going to be managed well with trust boards, health authority boards. They put patrons, lords, ladies, baronesses down to the oligarchs of the banking and manufacturing industry. And then they have, that is one scale of management. They're so miles and miles away from the actual delivery of good care. They then, on the other hand, have limitations which are beyond belief, saying we can't employ people from Australia or Canada because we're now in the European Union, so that we've got to give only a person not speaking English from Eastern Europe a job. So we have this complexity of political interference, hierarchy, change upon change, and in that process, the waste of money, which is unbelievable. Now, not only they don't change the they are losing the money because of constant change. It is said to save money and redistribute resources, but in fact, it wastes money. It doesn't redistribute resources, and it doesn't necessarily improve the quality of care. So that we do have this treasure of organization. However, this treasure of organization since 1948 to 2021, there is a leveling of the service to a certain extent throughout the United Kingdom, which was the aim, and a very good aim. So generally, a person is supposed to get the same treatment in any hospital for a given disease entity. In fact, this is not true, because not only it's not true, it is not the same, but what they have done, they've not leveled up, they've leveled down. So the great institutions of teaching and training of doctors and nurses and everybody else has been lowered. So the two are not meeting in an equivalent manner. There may be some improvement in the worst hospitals, but they've also non-improvement in the best hospitals. Now, how it's solved, and all the think tanks in the world, I despair. I know when I was director working with many departments in the health service, they would have an idea that we would spend £250,000 not on drugs or beds or comforts or recuperation or community service. They would have this idea of KPMG coming to tell us how to work. Not one of these reports were implemented. So we have this jewel of the service. We have this political tittle-tattle, I would call, all the time, and nobody says what are the real issues. And the real issues are to have units which are manageable and the size which is related to the community and function they are meant to perform, which will be different. Great Ormond Street Children's Hospital, as a major specialist hospital, must function in a particular way. An enormous district hospital must function in another way. There shouldn't be great directives from above, but individual administration for their particular function. They should look at the education of doctors and nurses. They should look at the amount of paperwork a given doctor and nurse and the secretary or anybody working in the NHS wastes in actually non-productive and non-patient care. Now, the complexity is enormous. Nobody has managed to solve the problems of waiting lists, of actual state-of-the-art care. But what we have got, and it is extremely frightening for a clinician and administrator such as myself, and particularly in my own field of cancer care, we are not in the top league of cancer survival. We are well in the middle. Now, how can we be well in the middle if our protocols, if our ways of treatment, if our expenditure, if our research facilities, the end result is not good? And we must remember, I'd only take cancer as an example, that 45% of people in this country will get the disease by 2025. Now, I suggest, and I would put the blame also on the profession, the senior members of the medical profession and nursing profession who advise government and tell them what they want to hear at a given time. But I think we should look at people working in the NHS, look at their functions, their job descriptions, and particularly the education of the medical students and postgraduate training of doctors and nurses. It's fundamental that they don't waste their time in undue administration and paperwork, and looking at their ethos and interrelationships within these hospitals. We must also look at each individual part of the NHS and its relationship to the community, such as their catchment area, and have a bottom-up approach rather than an approach from top down, which confuses and doesn't match the very function of each institution. Thank you for listening. I hope you found this interesting, and if you did, please subscribe.